Hey everyone, Irene Lyon here, and welcome to this entire world of nervous system health and healing. And before we get into today's topic and video, which is an important one, I also want to make note of a time-sensitive announcement, important thing, and that is that on the 21st of February, which is on Tuesday of this year, 2023, that is the final day for enrollment to new members into my 12-week curriculum and online program, Smart Body, Smart Mind. I'll say that one more time. This Tuesday, the 21st of February, 2023, is the final day to register into Smart Body, Smart Mind for this first intake of this year. I am not sure if we're going to run it again in 2023. So if you want to dive in and do the work with me, and this is where we do the practical work, the neurosensory exercises, the education, the support. It is a powerful, robust, and comprehensive curriculum. So if you want to learn more about that, if you don't know what that is, somewhere near this video will be a link to our information and registration page. You can check that out. And depending on when you see this video, we might still have one more live Q&A call that you can attend to ask questions. Of course, always ask my team, support@irenelyon.com, if you have any questions about this curriculum. All right, today's video, I want to blend two topics. What I want to do is talk about why what some people call little t, this stands for little traumas, are just as, if not more important. Not that the big T's aren't important, but that little t's are just as, if not equally important to what people would call the big T's, meaning big trauma. Now, what I think people mean when they say big T, big trauma, is big shock traumas like accidents, war, abuse, attacks, like things that you can actually say, whoa, that is a big ass trauma, and no wonder why this person has PTSD, complex PTSD, and the host of other chronic ailments that can come after such big traumas. Now, little t's, and I don't use this lingo, but many people do. This might mean emotional abuse, verbal abuse, little tiny things, little misattunements that happen to us when we're young. Someone might even say that this is something that would happen at school, where you're yelled at, where you're not hit, but you're abused verbally. Now, I hope if you've been following me for a while, and if you're new here, this will be perhaps new learning for you. The traumas are all equal. And I don't mean equal in that they're exactly equal. What I mean is one trauma that is seemingly not tough for one person might be a huge deal for someone else. And it really depends on the person's, what we would call regulation, their capacity, all sorts of things like that. And I won't go into the details of this, but what I would suggest if you want to dive deeper after this video is watch the first video of my free healing trauma series. The first video talks about why one person and another person might get into the exact same, let's say, accident, but one person walks away totally fine and another person walks away and they're debilitated. And it's the same minor physical accident. In this video, I talk about a tiny little fender bender, which is a car accident where there's no big blow up problems, but the outcome in the individual is very different. So I do encourage you to check that out afterwards. So let's get back to this little t versus big T trauma thing. What we have to understand, and I'm going to define what trauma is in my scope of practice. Trauma is not in the event per se, it is in the system's physiology. To simplify it, it is in their nervous system. And it shows up in the dysregulation of the nervous system. So to simplify this, how our fight and flight and freeze, these are portions of our autonomic nervous system, how this fight, flight, the sympathetic nervous system, and how the freeze, which is part of the parasympathetic nervous system, this is where that good old vagus nerve comes in, how these three fight, flight, freezes, these energies are together and usually contained in the body. Often the person doesn't know, and these energies are creating havoc. They're creating chaos inside the person's physiology, in their organ systems, in their immune system, in their thinking capacity, in their ability to connect with the environment, with themselves, to calm themselves down naturally. So fight, flight, freeze, when this is on in the system, when there isn't an actual threat, right? We need fight, flight, freeze when there is a true threat coming at us, when we're under stress, we might need that. An accident happens, we need that to come in. But let's just say you are not under actual threat. You are not in an actual accident in the moment, but your system has this dysregulation, this fight, flight, and freeze on 24/7. We would then say that this person is living with survival stress, living with old traumatic stress. Their system is dysregulated. And just to go a little farther with that, or further, I should say, this is what can create chronic illness. This is what can create autoimmune conditions. I've talked about these things in other videos. This is what can create what we would call mental illness disturbances, anxiety, depression. And one hot topic that I want to include in here is fibromyalgia. We could also say chronic pain. I'm going to read from a book, quite a long passage actually, that's important, that speaks to fibromyalgia. But before I do that, just another element with these little T's. So if I break down, say, this concept of verbal or emotional abuse, or when we were really little, right, before we had self-regulation, when we were learning the skills of being a human in this world, if our primary caregivers didn't know how to attune to us, in other words, they didn't know how to read our signals. So when we were upset, maybe we were ignored. Or maybe when we were hungry, we were ignored. Or maybe when we were needing to express exuberance, we were told to go to our room. So there's a million ways I could explain attuning to you, but essentially, in a nutshell, when a little one is learning to be a human and they don't have proper self-regulation on board yet, and the interaction with the, let's say, parent is not the best, it's not attuned, and let's say they're sort of left alone, they feel alone, they don't feel heard, they're literally not held when they need holding, the world is unsafe, the world is unpredictable, they can't count on that connection. Over time, that little person starts to become dysregulated. But what we tend to do, and what humans tend to do, is we go into a freeze response. We go into a shutdown, and eventually, depending on the situation, our system collapses. It can't fight, it can't flee when we're 3 years old. We have to stay in that home system. And so we default to shutting down, to freezing, to disconnecting, and we really stop trying. Our life force energy kind of fizzles. We know through research, specifically the Adverse Childhood Experiences study, I'll link a thing below this to explain what that is if you want a deeper dive, but we know through this research that early adversity, early traumas, this dysregulation, this stored survival stress of the fight, flight, freeze, if not addressed at that core somatic nervous system as well, nervous system level, left unchecked, it will create and result in some form of chronic illness, some form of mental disturbance, even addiction, etc. Fibromyalgia fits into this. And so I wanted to just lay that out for those of you that might not have a memory of severe abuse growing up in a war-torn country. Let's say there was plenty of food in the fridge, there was heat, you had a bed, you had clothes, you went to school, but these quote-unquote little traumas kept happening. Little bits here and there, and you might not even remember them because they were happening before you could form a memory around them. A lot of people who are older, who have these chronic conditions, they don't have memories of their childhood. And for some reason, that's because they were really young, so under that age of sort of 5-ish or 3. But for others, they were in a disconnected state from their body, from their environment, so the memories just didn't get formed in a good way. Hope this is making sense. Now, of course, big T's, big traumas as we might define them, or other people, they are just as important and they can lead a person to such chronic illness. But like I said, I wanted to address what we would call these quote unquote little T's so that you, or let's say clients that you work with, can understand that the reason why they might be struggling is actually indeed very real. And it's living in that survival chemistry in the body. Now, quick note, to heal and to work with these dysregulations, that's exactly what I teach and say my colleagues, if you work with a very skilled somatic experiencing practitioner who also has training in early trauma, this is the sort of work you would do with that person. It's not about rehashing a physical attack or defending ourselves from that tiger or whatever it might be. It's slower, more what we would call titrated. I'll post a video below about what titration is. Slow, foundational, step-by-step growing of capacity so that you, the person who, let's say, is living with these little T's inside of their system, which are just as real as the big T's, they start to shift. The body starts to open up. These little T's start to move through and out. The sensations, the somatic experiences, the panic, the fear that might be so subtle, but it's in there. It starts to move and it starts to shift. So again, this is what we work with in my programs and courses and what a good trained practitioner of these levels would do. Okay, what I want to do, I want to read a passage. This is from a book called Trauma Spectrum by the late Robert Scare. I just found out that he passed away, I believe it was in 2021. And I like to always reference this book, again, Trauma Spectrum, Hidden Wounds and Human Resiliency, because I don't believe he got enough credit and enough exposure when he was around. But this book is one of the best books for describing, let's say, the condition, the naming of what we would call fibromyalgia. So bear with me when I read, get comfortable, grab a pen and paper if you want to take notes. It's just such a great expression that I want to read some parts of this because it connects to the symptomology as well as the representation of fibromyalgia when we look at it as a trapped survival, stress, and energy situation in the body, and why we want to work at this nervous system level, at this somatic level. All right, so this is on page 218, the chapter Disease of Stress and Trauma. So this is all on fibromyalgia. The primary symptom is diffuse musculoskeletal pain, especially affecting the axial or core parts of the body, associated with a glue-like stiffness of movement. Fibromyalgia also involves exquisite tenderness over specific points of the body, and the only remotely objective test for this syndrome is to document tenderness in at least 10 of the 18 pain points. This skeletal pain cycle is unpredictable in nature. I'm going to say that one more time. It's unpredictable in nature. Although it is generally made worse by emotional stress, physical activity, and cold or wet weather, it is often improved, although not abolished, by local heat. Now, just want to speak to this for a second, because someone the other day was saying, how come you don't speak more about fascial pain, Irene? And here I'm speaking about it now. You know, it takes time to get through all these topics, but yeah, the fascia of the body, which is the sheath around the muscles, we actually feel and believe that a lot of the muscle pain isn't necessarily in the muscle, it's the fascia around the muscle that is braced, that is tight, that is taut, that is adhesed. And so this is why it can be useful for some people, not all, to get some body work that focuses on this system, the fascia system. And we do address this in the work I do with my students. So this is a real thing. Fascial tension is real. Next paragraph. Virtually all fibromyalgia patients experience daytime fatigue. and weakness. I know a lot of folks will say this. This is specifically associated with awakening, so waking up, feeling stiff, tired, and unrefreshed, although insomnia per se is not a part of the problem. Nevertheless, many fibromyalgia patients experience delayed onset sleep and multiple awakening episodes, often due to skeletal pain. I've done other videos, so I'm just going to comment on that in the past about why people wake up in the middle of the night, often in panic attack. But again, I'll post that below here if you want to check that out. This awakening in the night is because the system is so braced, it's so tight, and it's almost creating a trigger, a stress response. I personally have experienced this exact same thing. And again, my traumas were subtle and not necessarily, again, what we would classify as big traumas, but subtle enough to teach my system to brace, right? And so my sense is if I didn't have the knowledge I have, it's really possible that I would have gone to a doctor a couple of years ago and they would have said you had fibromyalgia. And I just knew that wasn't the case. I know this is old survival stress from the many accidents I've had growing up that are starting to come out and release. And it can be painful when these things come out. All right, continuing. Fatigue is severe enough to result in almost involuntary collapse at times. That's that freeze, shutdown response. I have treated a number of patients for dramatic symptoms of collapse during which they suddenly lose all strength and literally sink to the ground, lying there for long periods of time, unable to force themselves to get up and go to a couch or a bed. Of these patients, all of these patients have had significant recent trauma, and the collapse is the context of other trauma-related symptoms. Most have experienced a state of entrapment or irresolved approach avoidance conflict. This is him putting in that attachment piece. When we were really young, if there was conflict, if we reached out for our mother and she didn't respond to us, or when we were sleeping and being gentle, we were woken up and startled awake, right? So this is how he's bringing in this early trauma piece that, again, many would consider quote unquote little t. Several have concomitant, so at the same time, visceral hyperactivity symptoms and several definite fibromyalgia. So several have had these visceral hyperactivity symptoms and several definite fibromyalgia. I'm not exactly sure what he means there. The hyperactivity, the viscera, that would mean that the visceral activity is getting really, really intense in that survival fight, flight mode. I believe that the weakness and collapse that is seen in fibromyalgia and other post-traumatic stress states relates to the parasympathetic immobility of the freeze response. So again, this is just reiterating what I have already mentioned, but sometimes it's good to hear it from AMD. Interestingly, the phenomena of awakening with pain in fibromyalgia and other trauma-related skeletal pain syndromes is linked to, I believe, a symptom of muscular bracing combined with an abnormal vasomotor tone during the dream state, the rapid eye movement state cycle of sleep. As I have noted, one of the roles of dreams is to integrate the day's stressful or threatening experiences with past procedural memories of the threat and trauma in order to replenish and expand the survival brain's storehouse of remembered survival skills. That was a mouthful. Basically, he's saying that when we sleep, we process. It's a house cleaning situation where we're getting rid of the old junk in our system. And what will occur is if there's a lot of survival stress trapped in this autonomic physiology of ours that connects to the muscles and the gut and all of this, it can create kind of this storm inside as we're trying to process. And so oddly, what we do, not oddly so much, but what we do in the day to help grow capacity and work with our physiology and our system will influence our sleep so that when we are sleeping and unconscious, our system knows a bit more really how to do these things. All right. What else do I want to read here? Here we go. The muscles bracing, so this goes back to sleep, reenacts what the body did during the traumatic event. Now remember, it doesn't have to be a big blowout, big T. It could be the body freezing because of being screamed at, or even being touched in a way that was a little forceful, wasn't meant to be abusive, but let's just say you have a parent who is just not attuned to themselves. They don't know how to be gentle. They don't know how to be delicate, and they pick you up as an infant or a toddler, and it frightens you that the fingers are pokey, the fingers are too tight, and that will send a response into the little person. Something is dangerous, but this is my parent, and they're touching me in this harsh way, and so we brace. So it doesn't have to just be, again, due to a big accident. Just cannot stress that enough. Constriction of blood vessels and muscles that are contracting cause severe pain, as in a heart attack, right? We'll get that tightening around the chest that literally can feel like we're having a heart attack. Sometimes what's happening there is that, again, that fascia and the systems, the layers around the heart are constricting, and it causes pain. This leads to immediate awakening with pain, often in the core of the body, the head, neck, or back, which might be braced before any other self-protective behavior can begin. Therefore, the symptom of awakening with pain is, at least in part, related to arousal or that sympathetic part of the exaggerated autonomic cycling in trauma. So again, there's a lot of words there. What that's basically saying is that this is in relationship, again, to waking up from sleep and being so stiff and so sore, is the system is literally looking to fight. It's braced, but it hasn't released that energy. And so again, sometimes when this occurs, we have to work at feeling our body, starting to move our body, starting to wake it up with gentle movement, with orienting, and trust and know that the system is not necessarily broken, but it's in a survival response. These tension patterns are there for a reason, but then we have to work with them, open them up, help them move so that flow can start coming to the system. One more piece here. Fibromyalgia is so inclusive of many separate syndromes that it may be considered to be the prototype for post-traumatic autonomic illnesses. So that again is a big bunch of words that basically is saying that this general quality of bracing but collapse and the system being stuck in fight, flight, and freeze is this prototype for a whole host of other chronic illnesses that we tend to see. Although there is no solid scientific literature, now this book was written quite a while ago, so there might be now, there's no solid literature that addresses these issues. I have a strong sense that fibromyalgia may be well based on extremely early and probably preverbal trauma that often is difficult to document in a patient's clinical history. I'm going to read that one more time. Want to make sure you're hearing that. I have a strong sense that fibromyalgia may be well based on extremely early and probably preverbal trauma that often is difficult to document in a patient's clinical history. The presence of complex trauma beginning in childhood with resulting vulnerability to subsequent relatively minor traumatic events would certainly be in keeping with the well-recognized association of the onset of fibromyalgia with viral illness, medical procedures, and often minor physical injuries. We will have to see whether this hypothesis survives the test of time. What he's saying there is what I said a moment ago, that when we have this dysregulation that is already in our system from these earlier traumas that go unchecked because they weren't big T's. As adults, we grow up and then we have something happen like a surgery, like an accident, like an illness, a death, a very stressful moment. And what it does is it activates, it triggers an existing, already stressed out, dysregulated system. Again, this is what I talk about in that video 1 of my healing trauma video training series. Okay, one last piece here and then we'll wrap this up. A review of the laundry list of apparently varied conditions linked to fibromyalgia reveals a subtle but distinct thread of continuity. Most are associated with abnormal function of the organs and glands of digestion, elimination of waste, blood circulation, and control of the peripheral vessels. In most cases, these conditions are associated with abnormal parasympathetic activity, that's that freeze response again, including excessive secretion of the stomach acid and increased contraction of smooth muscles in the stomach, small intestine, large intestine, and bladder. Some are also associated with symptoms of abnormal sympathetic tone, dry mouth and eyes, and some with exaggeration of abnormal cyclical sympathetic sympathetic activity, tongue twister there, such as Raynaud's and mitral valve prolapse. In Raynaud's phenomenon and other issues, he's naming one, livido reticularis, the small vessels of the skin are specifically affected by excessive autonomic cycling, leading to alternating states of dilation and constriction. In general, however, there is a universal pattern of parasympathetic dominant disruption of the rhythm of the autonomic homeostasis consistent with the freeze response. That was a mouthful. In simple terms, what that's basically saying, when our fight, flight, and freeze, to bring this back to what I said at the beginning, fight, flight, and freeze are on at the same time and the system still thinks it's in threat, even though the human being might not even be aware that that's happening, because that's how they've lived their entire lives in this dysregulation. It interferes with our digestion, with our glands, which in fact influence our hormone release. He mentioned the Raynaud's and this cycling of sympathetic and parasympathetic. This is where you have hot, cold, and that can create pain. This also can create migraine headache and severe menstrual disorders, which he didn't mention, but I know that that is connected to this. So all this to say, and thank you, Dr. Scare, for writing this. For those that want to dive deeper and read more, I do suggest this book, Trauma Spectrum. It's showing exactly what I have seen in my practice, in my work with my students online, that when they start to take this strong fight, flight, freeze off, in other words, they start to lessen this survival chemistry in their body, they start to release old memories that are held in the tissues, they start to grow capacity to be connected to the world around them. All these things start to let go of and essentially heal and release these held, trapped survival stresses of fight, flight, and freeze. And then in time, with time, this is what creates regulation, right? So we're going from a dysregulated state that probably for many people are a result of these quote unquote little T's that they had no clue that they had, but they know they're having these physical symptoms later in life that nobody can figure out, right? This is the common thing that my students say. Nobody can figure this out. And the reason is it cycles. Just like he said, there's an autonomic cycling. One day it's like this, and the next day it's like that. And even the lab work shows often that everything is fine. But that's because what's happening is at a much deeper cellular, autonomic, survival-based level. So to wrap this up, little t, I don't like that term. I wish people would stop using it, or if they use it, they explain that it is just as big, if not bigger, than the big T's. So I hope that we start to change that language. And also that, of course, big T's, the war, the abuse, the attacks, those are real too, the accidents. And it depends on how it is setting in the system, in the nervous system, and how it's impacting the vasculature, the organs, all the things that I read in this text from Dr. Scare. Like I said again, this is exactly what we teach our students to do in my programs. And again, if you were to work with someone one-on-one, this is what you want to work with. If you know you are living with something like fibromyalgia or a condition that is similar. So look out for those that work at this level. Again, if you are interested in working with me and doing the work with me in Smart Body, Smart Mind, we get to all of these levels in that curriculum. We work with the layers of the body, we work with the viscera of the body, we work with the connection with the environment and really helping you restore safety and regulation at that cellular level. Thanks for watching and listening, everyone. I know this was a little longer and a little more complex, but so important to understand the deep detail of what is happening inside. And if you know someone who is struggling with these conditions, please send them this video, send this to your doctor, get them to get the book Trauma Spectrum. He was ahead of his time, as was my other colleagues and mentors, Peter Levine and Kathy Kane. They have the same similar, if not exact view that Scayer has, and now you do too. Thank you for being here, and we will see you next time.